If your skin itches or turns red from time to time, you might have eczema. This skin condition is very common in children, but adults can get it too. There are different types of eczema, and to tell us more is dermatologist Dr. Irshad essack. Assalamu alaikum, doctor, and shukran for joining me.
Walaikum salam wa rahmatullahi wa barakatuh. Jazakallah for inviting me to your show.
Alhamdulillah. All right, so doctor, tell us exactly what eczema is.
Eczema is actually an inflammatory condition where your skin
Mhm.
becomes inflamed, it becomes red and itchy, and it's actually a quite common condition that occurs mainly in children, but can extend over into adulthood as well. Yes, you are correct by saying that dry skin is a contributing factor to the eczema itself, because dry skin itself can make the skin itchy. Itch will drive scratch, and eventually, as you begin to scratch the skin, you begin to release certain types of chemicals, mainly histamine, that then begins to drive the itch even further, which then makes you scratch further. And with more histamine release, it then can become a chronic or a debilitating problem. So eczema is quite common, and eczema is a lot more widespread than we think.
Mm-hmm. All right, so I do believe that there are different types of eczema. Can you please expand on these different types and their symptoms as well?
Look, let's stay with the cardinal symptoms. The
Mm-hmm.
most important symptom that you would experience during an eczema is pruritus or itch, and this itch can vary in intensity. In some individuals, the itch may be very localized to one particular area, giving you the type of sensation that literally wants to make you tear your skin apart. So it's that
Mm-hmm.
intense localized itching. And in some individuals with more chronicity or long-term eczema, they can also experience a low-grade background irritation that can be there constantly through the day. So they would describe an itch intensity of, for example, 1 or 2 out of 10, whereas the former group may experience itch and they may describe that as being intense at a 7 or 8 or even a 9 out of 10. So itch is a cardinal feature of the eczema. Then, depending on whether you're dealing with a chronic situation or an acute situation, the eczema can present with red patches that are slightly different in texture. Um, in some instances, you can get small, very fine water blisters that may occur in and around the area, and these areas may be small, so probably like coin shaped, or in some instances, it may be involving entire areas of the trunk and the limbs. Um, as time goes by, with the constant and persistent itch, understandably, patients will scratch. And when they do scratch, they tend to tear the overlying skin. So you may also see features of excoriation or scratching. And that may also lead to the area becoming secondarily infected. So the primary problem is the eczema, but bacteria basically get in as a result of the broken skin. And sometimes you may have this honey colored dried crust that may occur in the more acute situations. In patients who've got more chronic types of eczema, they tend to have eczema whereby the skin's texture changes into a more leathery or an elephantine type of skin, whereby the skin markings over the top become a lot more exaggerated and deeper, and the skin loses its elasticity in some areas. So areas over the joints may become a little bit thicker, and because of the loss of elasticity, they end up having easy fissuring or slits that may occur in the skin, and that may be painful when you are having a bath or a shower or washing that particular area. And now you find that that adds to a further discomfort for that particular patient. And what I've just described now is the acute and chronic types of eczema and how it presents. But it will also depend vastly upon the subtype of eczema that you have. So, say for example, you have a patient who's having a type of a contact eczema. So the skin is coming into contact with something. A typical example would be cosmetic jewelry, which have got metals and alloys in it. So you'd end up having an eczema where that particular item is in contact with the skin on a regular basis. So, for example, piercings, earrings, nose rings, you may get eczema that occurs in and around the nostril area or on the earlobe itself. You may get eczema that may occur as a result of a contactant, like a jeans stud, the stud that holds your jeans button around. So that'll be around the umbilicus area, around the navel area. You may even find some patients have a contact eczema to certain types of coins. So when these come into contact with the skin, you may find that particular area becomes involved. Your watch strap or your watch buckle or the backing plate of your watch may also provide an area of contact eczema on your wrist. So it all depends on what is coming into contact with the skin, and that would also dictate what is the pattern of the eczema. But in the common types of eczema, which is the atopic type of eczemas, which are associated with dry skin and an element of allergies as well. So those patients have got an association with allergic rhinitis, so a runny nose, allergic sinusitis, so sinus problems, allergic conjunctivitis, so watery eyes all the time, or even asthma. These patients have a typical pattern whereby they have the eczema that tends to occur in the flexural area. So in the area that is um, on the opposite side of the elbows, the areas behind the knees are common sites for this occurring in these particular patients.
Mhm. All right. So, doctor, how is eczema diagnosed? Because I mean, there are a lot of them. So, would they have the same diagnosis?
Most dermatologists will make the diagnosis of a common type of eczema or an atopic type of eczema based on the distribution or the pattern of the disease. And this diagnosis, in the vast majority of cases, will be made on a clinical ground. So that's basically examining the patient. The more um, rarer or atypical or unusual types of eczema, we may need to resort to a skin biopsy to assist us because there are a few other conditions that may appear just like eczema. For example, psoriasis, and sometimes certain types of medication or drug reactions can also look very similar to eczema. And it is important for you to delineate or to separate them so that you don't, uh, in error, implicate the medication when it may not be the medication that's causing the problem. So what you would want to do is a biopsy to assist you, and we take a small piece of skin, a few millimeters in size, send it off to the laboratory, and we look at that under the microscope, and that gives us a better idea. Firstly, is this eczema? And we can get a hint sometimes as to whether there are other contributing factors to that eczema as well. So skin biopsy by dermatologists generally is used to confirm diagnoses or to assist us in identifying the more unusual types of eczema in patients. But
Hmm.
largely on history and examination, you can make the diagnosis of eczema.
Hmm. All right, doctor. Let's take a quick break, and when we come back, we can talk about the treatments available.
Regions in Africa and Afghanistan that are in need of water wells and boreholes. Once a water well in Africa at 14,500 rand. For a borehole in Africa and Afghanistan at 49,500 rand. Call Africa Muslims Agency on 011 834 8685 or donate at Africa Muslims Agency.co.za. Africa Muslims Agency, inspiring the spirit of giving.
Babu, why don't you loosen your belt a bit more?
But why now?
Well, it's very tight, blocking air to your brain.
Haju, this is only a start. I need to tighten up a bit more. Funds are tight and the cost of living is high.
Funds are not tight. It's your haram insurance which is tightening our barakat.
Okay, Haju. I will call my insurance friend tomorrow.
Maybe I must tighten up on my cooking from now on too.
No, Haju, we don't need to tighten up. It's okay. Look, I'm even throwing away my belt.
Don't tighten your belt. Change your insurance. Leaving Riba Insurance is easier than you think. Call Amana IFS for all your personal and commercial takaful needs. 0861 786 393. Amana. Leave Riba for good. Amana IFS is a registered financial services provider.
They say breakfast is the most important meal of the day, yet many children go to school hungry because of poverty. Penny Appeal's Breakfast Club aim to get a warm, hearty meal to underprivileged children so they can spend the day prospering in their schoolwork. Help feed a needy learner by visiting our website on www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal. Small change, big difference.
Listen to something fresh. Listen to Salam Media, your humanitarian broadcaster.
Welcome back. You are listening to the Mid-Morning Talk on Salam Media, and we are talking about eczema, the different types, the symptoms, how it's identified, as well as how it is diagnosed with the dermatologist Dr. Irshad Essack. Now, if you have any questions for Doctor, you can send them to us. You can leave them in the comment section below. We are live on Facebook. Send them to us on WhatsApp on 061 7660355. Doc, thank you for staying with us. Now, what treatments are available for eczema?
Okay, the treatment options for eczema can be approached in a tiered form. So, at the very basis, as we were discussing earlier on, that dry skin is a contributing factor. It is important that you're using good quality moisturizers. If you've got good quality moisturizers, you alleviate a lot of the itching. If the itching gets alleviated, you tend not to scratch. You tend not to add histamine to the inflammatory reaction, and you tend to make it easier for you to manage the eczema overall. So good quality moisturizers tend to work well as a foundation in the pyramid of treatment of eczema. Then, in addition to that, we commonly use cortisones or corticosteroids to treat the more acute forms of eczema. And there is a fair amount of steroid or cortisone phobia out there. But I think if someone is using a cortisone that is prescribed by one of their doctors, you should be fairly safe to be able to use it, even in children, so long as the cortisone is not being abused, because we all know that there are side effects associated with that. But if it's being prescribed and it is being monitored and you are being guided, I think you should be fairly safe with the use of cortisones when you are trying to treat an acute eczema. And these cortisones can be used either in an applied form, so an ointment or a cream or a shampoo, and it can also be used in an oral form, but again, under supervision. As I said earlier, you also have a predominance of histamine release when you have eczema and the inflammation that accompanies it. So it is also prudent to sometimes add an antihistamine for the patient. In most cases, this is given orally rather than given in the form of a cream or a topical. So antihistamines certainly form a very, very important part in the treatment of eczema to try to reduce the inflammation, one, and secondly, to try to alleviate the itch. Because as I explained earlier, you can get caught in this itch scratch cycle. There are other non-cortisone creams that we also use as maintenance. So patients who've got mild to moderate eczema, who's now no longer in the flare stage of the disease, you can give them certain types of non-cortisone treatments, like the calcineurin inhibitors. These are used as maintenance, and initially you start them off more regularly on a daily basis or twice a day basis, and then thereafter, as the situation remains well controlled, you can reduce that to 2 or 3 times a week as maintenance. There are other new medication called the biologics. Unfortunately, one of the limiting factors is their cost. But these are highly specialized medication that target certain types of chemicals that are responsible for driving the inflammation. They're becoming a lot more popular. They have had popularity in other conditions like psoriasis, for example. But in this country, we now have other drugs available. But again, I think that would be reserved for the use under specialist supervision. And you would need to have motivations done to medical aids to have this approved for you. Usually it's patients who basically used a whole host of other medications in the past, or someone who's got such severe eczema that it is interfering with their occupational and social lifestyles. So those are the ones who will probably qualify for that type of treatments. Then you have light therapy can also be used, predominantly ultraviolet B. There are centers that actually do light therapy, and how this works is that it helps to reduce the inflammation using ultraviolet B. So the cells that are causing the inflammation, they are made more sluggish by the ultraviolet B, and thereby they also begin to reduce the inflammation. Um, in addition to that, there are also certain types of immune suppressant therapy. So you remember I mentioned you can use oral steroid treatment. Oral steroid treatment can be classed as a steroid-induced immune suppressant therapy, but there's another whole other class of medication that you can use which does not use steroids. Yes, they do come with their own set of side effects, and every drug that can be used has got its own side effect and benefit profile, which would be weighed by a specialist before they institute the drug for the patient. And majority of these will require monitoring of some sort of kidney function or bone marrow function or liver function. These drugs are not benign in terms of their side effect profile, but if they are used properly and again under supervision and under strict monitoring, these drugs do have benefits in the long run for many patients who are either become immune to the use of cortisones or cannot use cortisones for other reasons or are developing side effects to the cortisones. So there are many treatments out there that's available depending on the one severity of the disease, the age of the patient, the body surface area that's involved, all that is taken into consideration before we prescribe for the particular patient.
Mm-hmm. All right, and for someone whose eczema is caused by an allergy, for example, asthma or any other problem or any other allergical reactions, would you first have to treat the allergy or do you treat them both simultaneously? How does that work?
In some cases, when you interview the patient, you do get a fairly clear history of there being an allergen or a trigger for that particular patient. In most cases, if that history is quite strong and direct and obvious, we would obviously advise the patient to try to avoid that particular trigger. In more subtle cases or where there may be suspicion of multiple possible allergens or possible triggers, we do send patients for certain types of allergy testing, so skin prick tests. We can do certain types of blood tests as well, like RAS tests, CAP tests, where we are able to then try to isolate the allergen. So it may be dietary, it may be something that's pollen related, or grass pollens, house dust mite. We do sometimes have to test for those in order for us to be able to more accurately advise the patient or guide the patient in what they should be avoiding. And on that particular topic, there's another host or a group of eczemas that we also encounter called the occupational dermatoses or the occupational eczemas. These are people who are coming into contact with certain types of allergens and or irritants at their place of work. So in the daily workplace, we sometimes need to do specific testing in association with an occupational dermatologist, and there we tend to try to identify what is the trigger for them at work. In that particular case, we don't always ask them to leave that particular work of employment. We may make a request for the employer to move them to more of a supervisory role or a change in job description where they can reduce the contact time or the exposure to that particular allergen. So there are things that can be done where we do interact with the employer to try to keep that employee gainfully employed, because you all know that jobs themselves are hard to come by, and for someone who's been in the job for 3 or 4 or 5 or 10 or 15, 20 years, it's sometimes difficult to have that particular person to change occupation suddenly, although they may require a change of environment because the eczema just becomes too debilitating for them.
Mm-hmm. Right, and going forward, what tips do you have to avoid outbreaks?
I think for anybody who's eczema prone, there are some simple things that you can do to reduce the frequency of your flare-ups and to reduce the severity of your flare-ups. Some simple things is, first of all, if you are bathing or showering, reduce that to preferably once a day or as infrequently as possible. Although we said that one of the driving factors or contributing factors is dry skin, it's kind of counterintuitive that the doctor is telling you to stay out of water. But your skin is not designed to just take water in through it. So the more you bath, the more you rub the body, the more you shower, the drier your skin actually becomes. So if you can keep the showers or baths firstly to shorter periods or shorter durations, as infrequently as possible, and with as coolest water that you can tolerate. We all know that things do get cold in winter and we want warmer temperatures, but the hotter the water, the quicker is the evaporation immediately after you come out of the shower. So if you are having a shower where you've got plumes of steam in the bathroom and you're done, the water is probably too hot. So shower as quickly as possible, and then come out of the shower and then pat yourself dry. Don't dry yourself completely with the towel. Pat yourself dry and leave a few water droplets on your skin. And that is the best time to apply your moisturizer, because your moisturizer will basically bind to the water. And as the moisturizer gets absorbed, it takes the water into the skin with it. And the most amount of water will evaporate within the first 3 to 5 minutes after the bath or shower. So apply your moisturizer, preferably while you are still in the bathroom, while you've got the steam and humidity around you. Take advantage of that. Yes, I do understand that sometimes in winter it does get cold. We all want to dive for a heater immediately, but that dry room with the heater on is what exacerbates and accelerates the immediate water loss to the skin. So try to seal that water into your skin with a moisturizer as soon as you can after the bath or shower. When it comes to things like soap substitutes, they are certainly advantageous over a normal soap. A normal soap that will have bubbles, that tends to strip your skin of its normal and natural moisturizers that you produce. So anything that makes bubbles, so bubbles, lather, foam, bubble baths, fizzy bombs, especially in children who like to have bubble baths, uh, it's an absolute no-no. The important thing is that there are many commercially available items out there which you can buy straight off the shelf, which you can add as a bath additive. So if the child still wants to play in the water, in the bath water, uh, you can still allow that, but it's just not a product that actually makes bubbles. Just make sure that these children are supervised for many reasons. One is because of the age, and don't ever leave them unattended, because some of these bath additives may make the bath a bit slippery, and you don't want to have an unfortunate accident in the bath as well. So soap substitutes also go a very long way in keeping the skin well hydrated in the long run. And then coming to clothing, try to avoid harsh fabrics in direct contact with the skin. So wools, acrylics, yes, we do understand it does get cold, but if you can use some sort of intervening layer between your skin and that woolen item. So a cotton spencer or a cotton long johns, cotton underwear will certainly be of an advantage in preventing that uh, harsh fabric from irritating the skin. Because once the skin gets irritated, it tends to itch, and then you're going to get yourself cells caught into an itch scratch cycle.
All right, Doctor, Jazakallah so much for your time and for sharing that information with us. Well, I know I definitely have to cut down my hot showers, but hey, it is what it is. All right, Doctor, shukran for your time. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Right, that was Dr. Irshad Essack taking us through eczema and the different kinds of eczemas and what you can do, and just a few tips on how to avoid flare ups, reducing your bath time, not just your bath time, but your bathing temperature and how often you do it as well. And your water must not be too hot. Um, Pat yourself dry and don't just rub your skin dry. Apply your moisturizer immediately when there is still some water droplets, and any soap that makes bubbles is a no-no. So there are some really good products on available. So um, yeah, you can go ahead and try any of those, and also avoid harsh fabrics onto your skin. So that is it. If you have any further comments or questions, you can leave them in the comment section or send them to us on WhatsApp on 061 All right, please stay with us. We will be right back.